So what we're going to talk about is Region 3 Emergency Preparedness Partnership. And Region 3 are the same counties that GRADD covers, the same counties that Green River District Health Department covers. So this group formed in roughly 2002-2003 due to the 9/11 and due to the anthrax scare. They realized healthcare maybe needed to be a little bit more coordinated and bring people to the table that perhaps had never talked before. When you look at who's in our partnership, we currently have all the county emergency managers. We could not function without them. And I can tell you as the judge exec, you have the ultimate authority for a disaster or an emergency in your community, and you rely heavily on the emergency manager's expertise and knowledge. So we have those people sitting at the table. All of our hospitals are included, including River Valley, the Child Psychiatric Hospital, and we have great support. I cannot stress enough the good support we have from Kentucky Hospital Association. The strength of all the hospitals in the Commonwealth can come together, and it is a truly unique thing to see happen. We learn from each other, and having all the hospitals is really quite powerful. Emergency medical services, guys, that's where the rubber hits the road. If they don't have a good service, then our constituents are in trouble. So we're very lucky to have all of the ambulance service participate, and these guys and gals are great. I would put our EMS services up against anybody's anywhere and just watch them go. They're really, really good. You have public health. You have mental health. A lot of people don't understand why we have so much involvement in mental health, but as a medical person, when someone starts having issues beyond my scope, and if I'm really busy in an emergency trying to take care of bleeding and breathing issues and keeping people alive, psychiatric issues are really not a general person's expertise. So to have that mental health person right at your side to help with that is invaluable. Often in disasters, we see a lot of mental health issues. We also have a lot of people in our community who are barely functioning on a daily basis. So when you add stresses of disasters, their symptomology can really exacerbate. We have private agencies. We have volunteer agencies such as American Red Cross and Salvation Army. They do great work. We have the Medical Reserve Corps. We have the CERT team members. So we have a lot of people that come together. Long-term care. Brenda Kennedy does an exceptional job coming together to help support long-term care as we look at disaster work. Wellington Park, with their uniqueness with Alzheimer's, sits at the table and helps try to decide how can long-term cares be a little safer, maybe get a little bit more involved, or at least know what resources that we have. We also fight law, we have fire, we have the schools, we have the universities. We have lots of people that will come at the table. A big component that we bring to the table is the faith-based community. Often they have many, many resources that they want to share. If y'all remember the ice storm, if it weren't for our churches in the community, I'm really not sure what we would have done. So why do we even have this? The state, CDC, which is kind of like God to public health, who says this is how it's gonna work, and I mean that, and they are the authority, and they basically say, we know people aren't prepared. So they say, here are some categories, some benchmarks that we need to look at to make sure that the communities are resilient. They give us those benchmarks, and what we realized is we were inadequate in our community. We did not have the resources. No hospital, not even Owensboro Health, or Methodist Hospital, or Ohio County Hospital, or the River Valley had everything they needed. Neither did the ambulance services, neither did public health. So when we sat at the table, we were given some money and benchmarks. So that required buying stuff, and that required a lot of training, a lot of drills, and a lot of exercises. So one of the other things is if you're bringing people together in a partnership, and you all know that, I know one of the things that I'm sure everybody's asked about, what's for lunch, and Kim's already said Moonlight's coming, but people want a perk for their efforts, and I mean that. So one of the things not only is the ability to work together, but you get to know people. You know what's in your community, and sitting at the table and knowing who somebody is a wealth of information, more than you can imagine. Benchmarks. It's all about surge. I had the CDC officer who I wound up sitting next to in a meeting basically say, it's all about surge. Can you handle the number? Can you handle the number? And when you look at the numbers, we have to look at, can the hospital surge? How many beds do the hospitals truly have licensed? And then how many can they really take care of? And it's different in every county. What can the alternate care sites, if the hospitals have to set up alternate care sites, how do they do that? And where are they going to be? And is everybody wanting to use the same place? Is Red Cross wanting to shelter the same place that the hospital may be wanting to put an alternate care site? And what's the difference? And then what's the difference in sheltering? All these things have to be decided amongst the region. We had to develop fatality plans. This came from the pandemic, and I think I've actually been to this group and talked about the pandemic, but we could have death beyond the normal numbers that we're currently seeing should a pandemic occur. And I know there's a lot of sensitivity on what's going on in China right now with the H7N9. But if we were to have that many deaths, we would incapacitate our current funeral home industry. So we brought them to the table and said, what can we do if this would happen? Hopefully it never will. Let's just be honest. I hope it never happens. But in the United States, we treat people, whether they're alive or dead, with dignity and respect. We want to make sure in a disaster we can do the same thing. We also looked at decontamination. There's a task force that was set up with other funding sources, and they merged into our group because we have to be able to decon people. If there's some kind of nerve agent or spill or something methyl ethyl bad that we need to be able to treat people with, we need to have that capability. So decon is another benchmark that we look at. Personal protective equipment, there just simply isn't enough. So we had to look at how could we stockpile, and in doing the stockpile, we have stuff in the east and we have stuff stockpiled in the west. So we have gloves, we have masks, we have cover gowns, we have a lot of that stockpiled to be able to provide safety for the first responders. When we look at this, we have to look at how are we going to be able to evacuate a community and how are we going to be able to shelter in place if we need to do that. And that is not as easy. A lot of people don't even understand the terms, but we are very, very lucky in a very unique situation to be opening up a new hospital. So we've been able to play in drills as if we were having to truly evacuate that hospital due to an earthquake or some other bad occurrence in the community. And we get to test the plans to see how it works. Could we move 1,000 people, and how long would it take us? What if they had functional needs? How long would it take us? And are we going to tie up our ambulance service? Because you're still going to have other stuff going on. So it really takes a lot of planning, a lot of consideration. The key is communications. The key behind everything, and the number one problem in any disaster in the history of man has been communications. Somebody somewhere felt like they did not have information that they needed to change a course of action. Communications is a problem. We are blessed. We are blessed with some of the equipment that we've got in our community and some of the work being done. I'm going to say this because he's like a little brother to me, but they haven't lived until they worked with Travis, who can figure out stuff faster than anybody, and that's what we needed. Somebody that can think ahead and think outside the box, and how can we communicate? What if the cell phones all go down? What if the landlines are all down? How could we do that? And I'm going to tell you, Travis is rocking them on the state level with ideas. So we're very, very blessed to have him in our community. Volunteer management, there's simply not enough workforce, so we have to know how are we going to handle volunteers that are coming in. And I'm hoping, even if you're not connected with Medical Reserve Corps or CERT or Salvation Army or American Red Cross, that if a disaster happened, you would want to volunteer and help. How are we going to handle that? We need your help. We might need your help. We might not need it right away, but we might need it day 2, day 3, because the events go on forever sometimes. We looked at resource procurement. As we keep getting more resources in the area, who knows what we've got? Who knows really what we've got? So we got to make sure the partnership knows, but that's why we're here. We need to make sure you all start realizing what we have. And I'm going to do a little song and dance right now. We'll come anywhere to talk to any group, to tell any group about what this is doing, and it's all free. And you don't really even have to feed me moonlight, although I will eat, okay? In looking at resource stuff, we said we had to make sure we had memorandums of agreement. But beyond just a gentleman's handshake, we said, we really need to get something in paper. What if I'm not in this position? And just because I know all the players, how can we make sure that whoever fills my shoes will know where we are? And you all know that. This is just good business sense. We also have a strategic national stockpile. The health department is integral in making sure that can be managed. This group has to be able to respond and help mass dispense medicines to the community if we need to. And they take that very, very seriously. And we've exercised and drilled that on several occasions. So we've learned stuff. As things keep happening, and we are a community that stuff keeps happening. That's just the best way I know how to put it. But we know that agencies need to have a continuity of operations plan. We know they do, and we also know that many agencies do not. Or they have one that's not perhaps adequate enough. So we really tried to go out and communicate to groups the importance, your importance, in a disaster, and how we want you to get back to normal just as quickly as we possibly can, because that's really the goal of all disasters, is to deal with it, to mitigate it, but to try to get everybody back to normal. So what did we see during the ice storm? Region 3 was some busy people during the ice storm, as were many, many other folks and agencies, so I'm not belittling anybody's work. But one of the very first things when I sat at the Emergency Operations Center was Angela find oxygen. And in everybody's plan, we were 3 layers deep with oxygen suppliers, meaning we had 3 layers of backup, and all of them failed. Listen to me, all of them failed. Now, as a nurse, I pass boards, and I know I've been nursing now for 32 years, but if you ain't breathing, I don't really care what else is wrong with you, okay? We've got to keep you breathing. So when people needed oxygen, that was a big issue. We also looked at durable medical equipment. A lot of people did not have supplies in their home to take care of themselves that had medical needs. You've heard about the hunger. They did a great job talking about that, but there were people with no food. None. Okay? We knew people were out of their medicines and couldn't get anywhere. We knew that transportation in general was a problem, even if warming stations were being set up or shelters. We're a rural community. It was hard for some people to get there. We knew pets were an issue. We knew that. There were people that wouldn't leave their home because of their pets. We knew fuel sources were an issue. So we started realizing even all the work we'd been done since 2002, 2003, and 2009, thank gosh we had done what we'd done, but we still had a lot more work to do. So how much stuff do you have on hand? A lot of agencies really don't know. And we started talking to the long-term cares, just the long-term cares, and it was mind-boggling how they got their medicines in. Some get them on Friday and they last a month, and some get them on Monday and they last 2 months, and some get them in the middle of the week and they last, and it's like, oh my gosh, how are we gonna figure this out? How can we help them? And in the hospitals, everything, if it's sitting on the shelf, is costing them money. So a lot of the hospitals in our community don't keep the amount of stock that I think Joe Q Public thinks they do. They're used to getting stocks in sometimes 2, 3, 4 times a week. So it's not what people think. So we have to get down to, well, what's the reality? What's the reality? We also needed to know what resources were available, so we have created a resource directory, and it's ever-changing and constant work. As new batteries are replacing stuff, you've got to keep everything up, so as this thing keeps growing, we have now got a team that their job in the partnership is to try to track and keep up with resources. It's gotten that big. We are trying to talk to make sure that agencies have their family involved in emergency preparedness plans. Does GRADD encourage their employees to make sure they have a personal protective plan? Because they need you all to be able to come to work. Okay, that's the bottom line. They need you all to make sure your family's taken care of so you can do your job in the community. And they do the same thing for us in public health. You guys having positions as mayors and city commissioners or liaisons to state officials, we need you all to have a plan because we need your leadership. We also know that most people don't have a communication plan beyond their cell phone. Everybody relies on cell phone now. So you got to start thinking about who can I call, or what can I do, or how can I text, or how do we let somebody know that we're okay, or where we are, because keeping up with people in a disaster can be really tricky. We also look at financial plans. A lot of people don't have money. And if you can't get to your ATM, then how might you be able to get food if you can get somewhere if it's not given to you? Or how do you buy the gas if your card won't swipe? And a lot of people are now really a cashless system. We're really getting to where we just have cards. And then catastrophic plans. I mean, what would we do? Now just stop for a second. What would we do if the new hospital went down? Now just think about that for a second. Now, that's a little scary. So we have to start thinking in those worst case and hope it never happens. What would we do? What would we do? So some pharmaceutical concerns. This is a huge issue and it's everywhere. But Region 3, we do not have a cache of drugs. I don't want anybody to think that right now. No drugs. We stockpile. No drugs at all. Okay? The state does stockpile some antivirals, and they're closely watching what's going on with the little HN factors, and they keep sending us notices, and so far it's all staying over there, but it's bodes watching what's going on. The strategic stockpile is chock full of medicines. Now we get an allocation of that. We don't get enough for all the citizenry, so then that leads into planning issues. How do you decide who gets what, and who's going to be the first priority? And if I go to Blaine Piper at Ohio County Hospital and say, here's your allocation, it's not my place to tell Blaine Piper who gets it. He's got to have a plan to decide. Do people have those ideas? And it's really tough, guys. This never stops. I just got to tell you, it never stops. We talk with our local pharmacies. They are great. They will do everything in their power to help us, but they are limited too. We look at what stockpiles are in our hospitals, and again, please do not think, and I'm not picking on the hospitals, it's just the truth. The hospitals do not have the stocks that people think that they're holding. They just don't. We look at long-term care, a huge population that we worry about. They're very vulnerable in disasters, as you can imagine. The poor, and children, and elderly are most disadvantaged. We have a mobile pharmacy asset that can be brought in. The state has control of it, so I'm really not sure that Owensboro, if something was going on in Louisville and Lexington, would be a draw, but we would be in the tally for it, and we could make the request. There's a national shortage of drugs. This is a huge concern. I don't know if this group's even discussed it or even thought about it, or it should come across y'all's table. It's not my place. But there's a huge issue with drug availability right now. Not just emergency medicine, but common medicines. common, cheap medicines. Synthetic use and abuse is a huge issue, and then governors can come in and help us with this, giving us emergency orders to help with medicines and bypassing prescription rules. I feel like I'm just babbling my head off. Okay, let's talk about the assets in here and what's out in the parking lot. We've worked very hard to get some assets here so that you all can see them and know a little bit about them. So this is just a compilation of some of the big stuff we've got. But when we say a trailer may be chocked to the gills with equipment, and you may not realize. So this may not sound a lot, but it's a lot, okay? We have one state trailer. It is out there thanks to Jimmy Van Cleve. It's currently housed in McLean County. It's about a $50,000 trailer. Its capabilities to handle 25 patients, 5 caregivers for a minimum of 3 days doing minor medical care. We have 4 alternate care site trailers. That means each hospital, each acute care hospital has a trailer so that if they have to move off-site somewhere and start setting up and doing triage or care, they can do that. They have some equipment to get started with that. We are the only ones in the Commonwealth that have a mental health trailer. And we realized real quick, and let me just assure you, real quick, you need mental health needs. And so we said, you all have a trailer, we're going to keep it at your hospital, chock it with stuff that you need to take care of the clientele. Now I'm going to laugh, and if Dr. Paula here would, she'd kill me, but I can tell you there's a lot of restraints on that. That's about one of the only things I can remember. But there's toys for children, there's privacy screens, there's a lot of stuff so that they can actually do counseling in the field. We have 4 points of distribution trailers. What that means is, should we have to give medicines quickly to the community, okay, because of because of anthrax or some issue, we have 4 trailers strategically across the region to help us do that. We have 1 in Henderson, we have 1 in Ohio County, we have 2 in Davis County. And they are fully equipped with what we would need to be able to dispense medicine. We have 2 shelter trailers. Those are just full of cots, and we have 2 kinds of cots. We have regular cots and bariatric cots, because not everybody is as thin as I am. We have 1 mass casualty trailer. That was the very first trailer, and EMS said, guys, if we have an event, we need to be able to get some resources quickly to the scene. It was absolutely brilliant. One of the things that we've looked at is we need these assets mobile so they can move around, and that's been a premise behind us on everything. We have bariatric supplies, and a lot of this is out there in the parking lot. Please, as soon as you get done eating, the guys get to go first, then they'll be out there. Please take time to go look at the stuff. They've spent a lot of time. This has taken a lot of effort to get all this supply here. Please, please, please. We have bariatric lifts, we have bariatric stretchers, we have bariatric wheelchairs, we have bariatric cots, and we have bariatric body bags, okay? And don't think we don't need them, we probably need more. We have a stockpile of personal protective equipment. I've said this earlier, we have 2 warehouses in East and West. We have over 700 body bags currently stored. Now you might think, oh, that's not really pleasant, but guys, if it were to happen, and we were to start having numbers that a pandemic could perhaps lend us, we do not have enough supplies. So the region said we will get the supplies in here until we can get more support. And then VeriChips, and it's a way to identify the dead if you have mass dead. And I know it's not pleasant to talk about, but Region 3's had to be up to their eyeballs in it. Okay, let's see. Oh, I'm sorry. Okay, other assets. We have satellite radios. We have 21 radios across the district. The one that's out there now is a mobile. We have some that you just put the antenna on the car and off you go, and you can talk on another satellite. We have a MyTalk unit that Travis is going to have out there. A manned, I just knew before, it's Internet Technology Assistant.
Mobile.
Mobile.
Technology Operations Center.
Okay, see, and I knew this and thought I needed a little cheat note. And then a panic case, I'll just let you tell them about that. But the panic case is one of the ideas that Travis has come up with that the state really likes. We have ham radios, we have the ham operator there that can show you how that works. We have mobile units. We have bought Emergency Operations Center equipment. We have bought decontamination equipment. We have a Bulls X fire training system, so you can actually act like you're putting out a fire with a video. It's on a screen. It's really neat. Because everybody wants to play with a fire extinguisher, and many people don't. And for agencies, it's very expensive to keep recharging them. So this is a way you just do it. It's like a video game. It's like playing a Wii. We have bought universal trailer hitches. I know that sounds silly, but what we're trying to do is make sure if the guys from Ohio County EMS need to go to Webster County EMS and get a trailer, that we ain't worried at 2 o'clock in the morning of who has the key and what does it look like. Everybody's keys are the same, okay? Everything is keyed the same, so we can get into it. And then we bought a lot of toys for children. If you're in a shelter, you got to keep kids busy. This is the partnership. It's the same 7 counties that currently GRADD covers. We do exercise a lot with regions 1 and 2. Our sister region is the Bowling Green region. So during the ice storm, Bowling Green sent us assets and we used them. They really weren't dealing with the ice like we were. There was kind of like a cutoff right there. So we got a lot of assets from Bowling Green. Okay. You are welcome to be a part of the Region 3 meeting. A lot of people in here have come for other reasons, but you're always welcome to come. We meet monthly, we rotate around the region, we do that on purpose so that we can see other facilities and see what their resources are. Please, I cannot say enough about how much effort went in to get the show and tell here. Please, 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 please take a moment to go out and look at it. We also do free training, we do free drills. You can be a part of anything that you want to be a part of and we will welcome you. If you have a facility and you say, well, man, I'm not really sure if our plans are what she's talking about, or I don't know what she's talking about, or what is a COOP plan, or, I'm not really sure, we can help you. We can have somebody review your plans and give you ideas.